Addressing healthy aging is a complex issue and not one solution fits everything. So we had to design several possible ways to address research needs and hence 6 simulation facilities. So we're really proud for the National Centre for Healthy Aging to deliver on its promise of providing preventative health for older people and people living with disability in Australia. These are 6 facilities that have been built that no one else in the country has that can help us work out how best to provide preventative health for older people and people living with disability in Australia.
We wanted to be at the cutting edge of research in ageing. So this required bold ideas, taking a bit of a risk, being adventurous, but always embedding that with what our stakeholders were telling us was something that would be useful, with something that would drive innovation in the aged care space and be something that would really inspire a new way of thinking in our researchers and our clinicians for how they could go about their work.
To have the independent living lab where people of all ages and all stages of life can come and visit and think about housing design, think about the use of technology in their life, it's just a fantastic achievement and really excited to see this National Centre for Healthy Aging dream come to reality.
I actually think the facility is amazing. For people to be able to come in and see these ideas put into practice, I love the sink that goes up and down. I think that would be really, really helpful.
The Intergenerational Playground provides an opportunity for people to come and engage in an environment that's specifically designed to be able to enable older people and people with disabilities to engage with the playground environment. This is the world's first open air laboratory that is embedded in a playground that helps enable physical activity, learning, intergenerational engagement and fun.
It's pretty good to see how we include people in this space and very inclusive.
A facility that we're particularly proud of is the Smart Ward, which is an aged care environment where we have multiple technologies to learn how to look after older people better.
So the Smart Ward has been installed on a GEM ward, which stands for Geriatric Evaluation and Management. And these are a type of subacute ward that cares for older people. So being able to capture the amount of physical activity that patients are doing in these settings is really important for helping to prevent deconditioning and functional decline. We can then use the data for research purposes and build up a much better picture of what happens to a patient throughout their journey through a hospital.
The Digital Library is a repository of video recorded healthcare consultations, education sessions, and also patients' healthcare narratives where they share a lived experience story with me. And then all of the videos are stored within the Digital Library for research and education purposes.
We're able to measure movement with the markerless system that we've got here. It means we can actually do activities that we would normally never be able to do. When I take patients through a space like this, use technology to then show them the results, they really, really love that because they get an assessment done and then we can get them immediate feedback about that and then we can give them information they can leave with.
This is just the start. We've delivered these 6 new facilities. We're now looking to partner with the community, with industry and government to really deliver at scale for healthy aging in the country. And this is an exciting future to look to.